Common disorders of the hand include trigger fingers or flexor tenosynovitis and traumatic injuries of the digits, fractures and sprains. Much of the examination of the hand focuses on the digits of the hand. To begin with, when you inspect the hand, you're looking for fusiform swelling or focal swelling of the hand. You're also looking for ecchymosis and deformities. Also, when examining traumatic injuries of the hand, you want to check for rotation. Two ways to do this. They can do it with their fingers extended, looking for asymmetry in terms of how the nails appear, and also inflection. All the nails of the hand should point toward the scaphoid. One other way to check this, if the patient is in too much pain to make a fist, is to have the patient relax and just passively dorsiflex the wrist. This causes the fingers to flex, and you can see if there's any asymmetrical rotation or scissoring of the digits. That may be consistent with a rotated fracture anywhere along the phalanx or the metacarpal. When you check range of motion of the hand, make sure they can fully extend all the digits, and then make a full fist. Other areas to check is to check full abduction and full adduction. When palpating the hand, this is also an abbreviated version of the common disorders. For trigger fingers, they tend to hurt over the distal palmar crease. This is in the same area where the tendon is basically triggering over the pulley, the A1 pulley. So they may be tender midline of each digit around the distal crease of the palm. When examining for fractures, you want to discreetly palpate along the metacarpals, depending on which one is affected. When you go toward the joints, you want to palpate dorsally along the collateral ligaments, whether it's the radial collateral ligament or the ulnar collateral ligament, as well as the volar plate. This is on the volar side of each joint. Provocative testing or special testing for common disorders of the hand, such as trigger finger, basically palpate the area of tenderness over the pulley and have them flex and extend the digit, and you may feel catching or popping over the A1 pulley. When examining traumatic injuries of the digits, specifically looking at the joints, we're going to check collateral ligaments. We flex the joint to anywhere from 20 to 30 degrees and add a valgus or varus stress. To check the integrity of the volar plate, you add a hyperextension directed force. You're checking for instability or laxity, as well as pain, and also endpoint.